My mental health continues to be a work in progress, but I've got some tools now to help me deal with what I've got in the future, but also we seem to have really resolved the issues that were there before. My name is Jo, and I am very nearly 40, just a few weeks. And I am a mum to a 6-year-old girl and a 3-year-old boy. And I work as a data engineer. I work full time, and I am a transplant athlete. I cycle for Team GB's transplant cycling team, and that has all come from the fact that I had a stem cell transplant 13 years ago. In my 20s, I went through quite an extensive amount of treatment for cancer, and I had a terminal diagnosis through this as well. But 13 years ago, I had a stem cell transplant, and that has proved to be curative. It took me a long time to realise that I had a problem. My husband, in particular, he had been asking me for years to maybe go and try counselling or something after the stem cell transplant. He knew that I was maybe not quite right, but there did come a real, I suppose, a turning point where I knew that I couldn't really cope on my own anymore, and I needed some sort of external help with everything. So it was that point that I reached out and self-referred. I feel very lucky that I was paired with a really lovely clinician, and she spotted that perhaps it was PTSD symptoms, and she had very recently qualified in administering EMDR. And I had never heard of it, never heard anything about it, but it really sounded like it could be a valuable thing to do. So what it has done is we have worked through what I now understand to be like a series of traumatic memories that I have, that I was holding somewhere in my brain that was not useful for me, and was affecting kind of all areas of my life, affecting my ability to make new memories, and affecting my everything, like kind of my work and my focus and attention. And we have applied EMDR and worked through this series of memories, and now those things are no longer a threat to me, and no longer seem to have the control in my life that they used to. So that just leaves me quite positive about the future, and in my ability to handle whatever comes at me, and for our family as well, and just be the best mum I can be, really. So with my cycling, I suppose I started after I had my transplant, so I've only been doing it for about a decade or so. And I've competed at a couple of British transplant games. I'm currently 2 times British road race champion. That's got me selected to be on Great Britain's team, of which will go to the World Transplant Games in Germany this year, and hopefully bring back some medals. This seems like a fantastic approach for patients like myself, and maybe long-term cancer survivors, and many other, I suppose, long-term illnesses. If it's been useful for me, I think it could be useful for so many more people. Yes, I would 100% recommend the service for anybody.